The new National Drug Use Survey shows more than 40 million Nigerians, mostly young people, are caught in substance abuse. Now, behind the numbers are overwhelmed rehab centers and a growing wave of women and teenagers slipping through the cracks. In this story, Just Nigeria's Mercy Frank meets those living with this reality and the experts working to stop a generation from being lost.
Substance abuse disorder slips in dressed as relief, but soon demands a pound of flesh.
I overdosed. Intentionally, I did that.
I will stay sober for 3 to 4 months, but the challenge came immediately. I went back to that environment.
And then it can grow into other, what we call co-travelers, anxiety, depression, psychosis.
One of us about to graduate in February has been called to the bar for the past 25 years. The Deputy Superior of Police have come here, even pastors.
With millions trapped, what happens when a nation looks the other way? The World Health Organization defines substance abuse disorder as the harmful or hazardous use of psychoactive substances, including alcohol and illicit drugs.
At the end, nothing matters again except that substance. You may even wake up first in the morning, that is what you are taking.
Nigeria has about 14.4% drug users.
10.6 million of them alone abused cannabis, followed by the opioids. When you talk of the opioids, you're talking of the pharmaceutical medications.
Once seen as a young man's habit, addiction now cuts across gender, class, and region. A peek into the only available data from the National Bureau of Statistics 2018 Drug Use in Nigeria survey indicates that the youngest age recorded for drug abuse is 15, while the oldest is 64.
But now we have onset of drug use has reduced, it keeps reducing to as low as 10 years of age.
The statistics also show that among every 4 drug users in Nigeria, 1 is a woman. Agi Uwem was one of those women, a nurse by day and a patient by night.
After my surgery, I also had a motor accident. So that drove me deeper into it because I was using it to numb pain. And so whenever the pain comes up, I'll just dive into using pentazosine.
Saadatu Muhammad was a promising student, wife and mother until she took a sip of the soothing liquid that stole 4 years from her.
My friend offered me the codeine syrup and I took it because I was complaining of sleep. I don't sleep much. The first sip was like I slept much. From 10 ml to 20 ml to half bottle per day, up to the time I was taking 5 bottles per day, including other substances.
But stories like Agi and Saadatu's don't happen in isolation.
People want to numb their pain. Emotional pain, loss, grief.
Peer pressures among youth. You have also the recreational elements. People just use it to have fun. But then you have also the addiction that is also a strategy used by organized groups.
As long as the supply flows, demand breeds, making escape feel like chasing smoke.
There are several sources of obtaining drugs by anybody who wants to take them. The legal way is to go through a prescription. You see a physician, he gives you a prescription, and you go to the pharmacy to collect it. In a hospital setting, unless the prescriber repeats the drug, you cannot go to the pharmacy and they will give you, they won't. But unfortunately in Nigeria, the drug space is seen like a business where non-professionals open shops and start selling drugs.
Nigerian organized crime groups have been central to drug trafficking in West Africa. The roads are quite open because we are operating in a free movement.
Recent busts by the Nigerian Drug Law Enforcement Agency (NDLEA) in Lagos and across several states uncovered large consignments of illegal substances, showing how readily these drugs circulate.
Officers had some operations in Ekiti State in about 2 days ago where they recovered more than 30,000 blocks of cannabis in a single plantation. So when you have this grown and cultivated in every state, it makes access and availability easier.
For many like Saadatu, the urge to break free came unexpectedly.
He went to the neighbors to play, and immediately out of rage, I don't remember thinking, I remember shouting, screaming, beating him, and in the moment of blind rage, I hit his head against the wall, and blood all over. That very day, I promised myself that I am going to recover.
But the gap to recovery is so wide, many fall through it.
So I picked my phone and I reached out to NDLEA, and then I started seeing a counselor there. I relapsed because I couldn't afford going to the counseling. It was, I think, 2 or 3 times a week, so I couldn't afford the transportation.
I was taken to an informal rehabilitation center where I was chained, beaten, and stabbed.
Cost is also an issue, lack of multidisciplinary approach, lack of reintegration, aftercare. If the person leaves, then what?
We have about 600 to 800 people that come for interviews and screenings twice in a year, but we can only take 200 at a time.
Agi and Saadatu were spared the pain of stigma, especially from family.
I was still very much in my husband's house. And sometimes he would just tell me, this is not who you wanted to be. I know you very well.
There were times that my mom sought help for me.
But not everyone is that lucky.
The lack of family and social support. Because people, they say, this one is self-induced. You went to take drugs. That's your business.
Substance abuse remains misunderstood in Nigeria, and the misconception often push people deeper into the shadows.
At that initial time, it looks as if you are getting high, you are happy, but down the drain is going to drain you of everything.
I think addiction is a choice, and if you are drug addicted, you really want to be because you choose to be.
So when you come to a pastor or imam to talk about your child that is drug addicted, just pray it away. It's not about religion now. They need help.
But breaking these misconceptions is only a link in the chain.
The first rule is prevention.
We're also driving the drug integrity test campaign to ensure that that is done to discourage young people from going into substance abuse. We are glad the federal government, through the Federal Ministry of Education, has adopted the policy now.
Say it is also the responsibility of the states within their own local government to ensure that the local drug committees are established.
We have just finished working on a document we call National Prescription and Dispensing Policy in collaboration with the Federal Ministry of Health, with what we have put in that document. And if we are ready to implement and enforce, we are going to have a sanitized prescription and dispensing policy.
Agi and Saadatu have now joined the champions, helping people climb out of the dark hole they once fell into.
I did cocaine for 20 years. I started with my journey at 13. Today I'm standing.
I was a captain in the Nigerian army, hooked onto hard drugs, cocaine and heroin precisely, for a period of about 15 years. I got reformed in 1994, and since then I've been clean.
Experts say recovery is possible for every Nigerian struggling with substance use disorder. With supportive families, compassionate policies, and the courage to reach out, the darkest chapter can become the first step towards a brighter future. Mercy Frank, Just Nigeria.